And now we should like to thank main sponsor Badr Sultan and Brothers Company, who will be presenting our next session, which be point of care testing and how to use ISTAT system in our setting. Dr. Osama Amir, mic is yours.
Yeah, hi, good morning. How are you? Thank you so much. الو هاي
اوكي واضح دكتور.
ايه
هاي.
بس شلون نسوي الشير للباوربوينت؟
اوكي.
هيك this one ها؟
دكتور أسامة بس طق على الشير سكرينينج ان جرين كلر.
يمكن لازم اطلع جعفوت على زوم.
لا
لأن طلب مني ليف ويبينار يعمل السيتنج. So can give me 1 minute to
اوكي.
هاي.
هاي دكتور. اوكي مايك از يورز دكتور نسمعك بس شيرينج.
Okay.
اوكي.
Okay. Sorry, it's first time using the Zoom. I'm so sorry. Hi, good morning. How are you?
دكتور أسامة بس بعد
ايه
بس ممكن تسوي فيو حق كل السلايدز من تحت الايكون اللي يم
ايوه ايه
شكرا.
عفوا شكرا دكتور. Hi, how are you? Good morning. Today I will talk about the ISTAT system. What is the ISTAT system and what the tests are available on this device and how we can use this device. ISTAT system is a handheld point of care device. It's easy to use, requires only a few drops of blood to provide results with minutes. ISTAT system results is accurate, reliable, and it's matched with lab quality. We did a validation in Kuwait for this device, and it's approved by laboratory departments. And the reference range of the ISTAT device equal to lab results. First, we'll talk about components of ISTAT system. The first one is the cartridge. It's the brain of the ISTAT system. And I will tell you later why it's the brain. The second part, it's ISTAT device. It's a small one, handheld. And the third part is the downloader. The downloader, we use the downloader to transfer the data from the reader, the ISTAT device, to the hospital information system, laboratory information system, and polyclinics information system. Your data can be documented in your system and the patient files. And the last part is the printer. You can print the result direct and keep it hard copy with you. And I would now talk about the process of using the ISTAT. It's, as I said before, it's easy to use. Only you need 4 steps to get the results. First one, enter information of the patient in the handheld by scan the barcode for the patient if it's available in your center, or you can enter by manual. If you can see in the picture, this is keyboard. You can enter the civil ID of the patient. It's so easy to use. Second step, it's collect the sample and fill the cartridge. The third step, insert the cartridge inside the device and you will get the result within minutes. The last step, download it you can see it by your system, or you can print it by iStat printer. iStat cartridge component, as I said before, it's a brain of the device. All the analysis process is done by this cartridge. As you see, this is sensor, this is sample chamber, waste chamber, and calibrant bag. One of the features of iStat is before each test is doing electric calibration and chemical calibration. Electric calibration, the device by itself before each test is check itself. And the second step is the chemical calibration, because the quality control liquid is built inside the cartridge. So the iStat is the safest point of care device, because if one of this calibration failed, the device will not give you the result. You can be sure your result will be accurate. And I will tell you something, the iStat device is just a reader. Okay, this is the iStat device, it's just a reader. It's only to transfer the information from the cartridge to the screen to give you the result. And now I will talk about the menu of the iStat cartridge. In Kuwait, we have 8 cartridges is a current item in the ministry. 2 cartridges for blood gases, and we have also 2 cartridges for chemistry, and 2 cartridges for coagulation, and the last 2 cartridges for cardiac marker. And we are working also for beta-SCG, but still it's not launched in the ministry. Let's talk about the blood gases category. We have CG4 cartridge and CG8. CG4, it's for lactate plus blood gases. If you use it, this cartridge will give you these parameters. It's the first one on the left side. The second one is CG8 cartridge, is for a part of electrolytes, sodium, potassium, ionized calcium, glucose, plus hematology, hematocrit hemoglobin, and blood gases result. Collecting sample, you need only whole blood sample from venous or artery. Time to test immediately by plain syringe. So you don't need a heparinized sample, no additional on a blood. So your electrolytes will be accurate because we'll not add any heparinized, because heparinized sample you will have add potassium or sodium. This is the heparinized. You will be sure your result is accurate. Result time, it's up to 2 minutes, including electric calibration and chemical calibration. So within 2 minutes, you will get your result and be sure it's accurate. What I noticed in the polyclinics, you need 1 day to receive the chemistry results. By iStat, you can get it by 2 minutes, and you can take the decision to treat your patient. Medical cases example, deep breathing, confusion, muscle cramps, arrhythmia. This is example by the cases that you can use this cartridge with it. Second category, chemistry. We have Kyria cartridge and Chem8. Kyria is just for creatinine test, and Chem8 it's for electrolytes, as you said in the table, plus the total CO2 and hematology, hematocrit and hemoglobin. And it's same, the CG4, CG8, collecting sample, whole blood sample, venous or artery, time test immediately by plain syringe, non-hybridized sample. Result time up to 2 minutes, including electrical calibration, chemical calibration, and medical cases example, confusion, weakness, vomiting, arrhythmia that you're using. Now we'll go to the third category, coagulation category. We have the first cartridge, ECT cartridge. It's for ECT test. The main user for this cartridge is the cath lab cardio OT, because they're looking to ACT result to know if they have to increase the dose of warfarin or increase. But I put it in this presentation to introduce the statute, to know what all the tests that can do it. Collecting sample, whole blood sample, venous or artery. Time to test immediately by plain syringe, non-hybridized, sure. Result time based on a blood, because if it will take from 3 to 5 minutes, but because why it's depend on blood sample, because if we increase the warfarin, the percentage of warfarin is high, the time will take more time to give you the result. If low, it will give you faster, but because that it's based on the blood. The second cartridge for coagulation is BTNR cartridge. It's for give you only BTNR result. It's collecting sample, whole blood sample, but in BTNR, we can collect it by venous or artery or finger prick. Only with this cartridge, we can take the blood by finger prick. Time to test immediately by plain syringe or direct from the finger. Result time, it will take from 3 to 5 minutes maximum. Based on blood sample. The last category is the cardiac marker. I think you will like it. It's very important for the patient. When you receive it, they have chest pain. You want to check if they have heart attack or not. This is TBI. It's cardiac troponin I test. This is specific for enzyme I. Enzyme I is specific for cardiac cases. It's for heart, because there are many types of troponin T, C, but troponin I is specific only for cardiac. Type 2 collecting sample, whole blood sample, venous or artery. Time to test immediately by plain syringe. Result time up to 10 minutes, including electrical calibration, chemical calibration, and the ISTAT is the fastest device for cardiac marker test, because you can't find faster than 10 minutes to give you the result. And the last cartridge is BMP cartridge. It's for chronic heart failure, to diagnose these cases. Collecting sample, whole blood sample, venous or artery. Time to test immediately by EDT tube and plain syringe. For this test, BMP, we have collect the blood by EDT tube. It must be full, and do gently check 3-5 times. After that, we'll collect the sample by plain syringe and insert in the cartridge. Result time up to 10 minutes, sure, including electrical calibration and chemical calibration. Interpreting this result, the result screen, and when you get the result, you can see in this screen of the result, patient ID, time and date of test, type of cartridge, test result. Maybe you will see it in 2 pages, the results, because like Chem 8, because you have, like CG8, because you have blood gases, hematology, and chemistry. But only you can change it by pressing the left arrow on the device. Right arrow. Interpreting this result reference range, as I mentioned before, our reference range match to laboratory reference range, but also the device give you marks to know if your result abnormal or normal. Reference range is indicated by a bar graph with tick marks. If the bar graph before the tick marks, I'm talking here about chemistry, electrolytes. Before first tick marks, the result will be low. If after the last tick marks, the result will be high. If the bar graph between the two tick marks, it will be in range, the result. But for gases, it will give you indicated by arrow. If the arrow to up, that means the result is high. If low, the result is low. If the arrow disappear, that means you are in normal range. And thank you so much. For any question?
Thank you, Dr. Osama. We have many questions. First, is the iStat machine available in the primary care?
Yeah, it's available in polyclinics in capital area. In all the capital area, it's available in emergency room. And also we introduced the device in Mitla polyclinics. It's opening before 2 months, something like this. And the Abdali polyclinics.
Okay, why not available in other areas and clinics?
And not available in another.
Yes.
اللي صار انه المدير المنطقه نفسها تبع المستوصفات ما كانوا بدهم اياه. يعني احنا جربنا ندخله بحوالي ما كان قالوا نو نيدد ما صار. وهلا في مناطق لا يعني عم بيتواصلوا معنا في دكاتره وان شاء الله we introduce there.
Inshallah, ممتاز. Other question, is the result of iStat is accurate like lab investigation result?
Yeah, it's accurate, and as I've informed before, it's matched the reference range, and already we did validate it in Kuwait. Yani the device is validated in the Ministry of Kuwait.
Good.
And I will mention something also. Already we connected iStat with the Hospital Information System, HIS. For sure, they will not connect it if the device not validated.
Okay, good. Other question, is troponin included and how it is accurate?
It's included, as I mentioned, troponin I, cartridge called CTN-I, and it's already is validated. And all the emergency department in Kuwait in the hospital depend on the troponin because, as you know, the result will get it within minutes. And the doctors, he can't wait the laboratory result because it will take 2 hours to get it. But he needs to be faster to give the medication for the patient, to saving his life of the patient.
Thank you, Dr. Osama, for informative
شكرا لك دكتور.
your feedback.
شكرا كثير لكم.
Thank you.